introduce all our speakers first. Mallory Koenings, National Program Leader in NIFA. Beth Curling, Senior Grants Management Specialist in NIFA. Stephanie Smith, Grants Management Specialist in NIFA. Michael Garcia, Program Analyst in Retailer and Issuance Policy and Innovation Division of the Food and Nutrition Service. Dina Nugent, a Research Scientist in Nutrition Incentive Program Training, Technical Assistance, Evaluation and Information Center, or otherwise called NTAE. Nova Fulmer, Director of National Partnerships, Fair and Food Network. We will be recording this webinar and we'll be putting it on the website, GusNIP website in NIFA web, and it will be available once we get it done with all the closed captions, everything. So it won't be very soon. And if you have any questions, please send it through the chat box, and we will take the questions at the end of all the presentations. We will not entertain anything before. Please hold on to that until the webinar is over. So in the chat box, please send all your questions. Thank you. And it is Melanie Koenings now.
Thank you very much for that introduction. Good morning, good afternoon for wherever you are joining us from. Today's webinar will focus on the Gus Shoemaker Nutrition Incentive Program, which we call GusNIP for short, specifically the fiscal year 2021 request for applications, or RFA. We will be sure to be in touch with all of you in the future about an upcoming webinar related to additional COVID-19 emergency relief and response funding that was appropriated in late December through the 2021 Consolidated Appropriations Act. We will also be posting frequently asked questions resources on the additional COVID-19 GusNIP appropriations. We ask that today's questions be entered in the chat box and focus on today's topic, the GusNIP 2021 RFA. Next slide, please. As you can see, the COVID-19 relief and response funding has some notable differences from the 2021 request for applications. That is the topic for today's webinar, including the matching requirement. We'll be focusing today on the requirements in the 2021 RFA, and we'll be explaining how all nutrition incentive grant applicants should develop applications for projects that they're well positioned to carry out and should be prepared with 100% matching funds. Next slide, please. So we will have our last mention of the GusNIP COVID-19 relief and response funding today, and ask that you reserve your questions on that program for the COVID relief and response webinar, so that today we can focus on the 2021 RFA, and we'll go ahead and get started. Next slide, please. Next, Litha. All right, to orient you to what these slides are going to look like, there will be a blue box in the upper right-hand corner that contains the page number within the RFA, where more details on the information being presented can be found. This slide contains where you can find the RFA posted, that funding opportunity, where the frequently asked questions for the GusNIP 2021 RFA can be found, a link to the core metrics for nutrition incentive grants and produce prescription grants. More on that will be presented by our Nutrition Incentive Training Technical Assistance Evaluation and Information Center partners later on. The deadline for these applications is 5 p.m. Eastern on Tuesday, March 16th, and all applications must be submitted through grants.gov. Next. Next. To set the stage on the purpose of this program, it is to fund and evaluate projects that are aimed to increase the purchase of fruits and vegetables by low-income consumers providing incentives at the point of purchase. The definition of fruits and vegetables is any variety of fresh, canned, dried, frozen, whole or cut fruits and vegetables without added sugars, fats, oils, and sodium. The Gus Shoemaker Nutrition Incentive Program also aims to bring together stakeholders from across the food and healthcare systems to foster an understanding of how we may all improve the health and nutrition status of participating households. Next slide, please. There are 10 clear GusNIP priorities that are listed in the RFA, and they're also listed here. We'll highlight that among these are maximizing the direct incentives to participants, involving a diverse array of firms, whether convenience stores, farmers markets, supermarkets, providing fruits and vegetables that are culturally appropriate to the target audience, coordinating with multiple stakeholders, and offering supplemental services to really meet the needs of our communities, whether that's online ordering, extended hours, or delivery. Next, please. There are 3 distinct grant types within the GusNIP program. Those are nutrition incentive grants, produce prescription grants, and then cooperative agreements. The cooperative agreement applications are not being invited in 2021. And so the remainder of this webinar is going to focus on the nutrition incentive grants and the produce prescription grants. Within these, there are 3 project types available. Pilot projects that are beginning to develop programs, generally operating at the county level or perhaps narrower. Standard projects that would be at the county, multi-county, or state level, where groups have already established and are enhancing their incentive programs. And large-scale projects, which have the greatest scope of all of the GusNIP projects, taking place at the state, regional, or sometimes even national level. Next. Next slide, please. Thank you. The goals for the nutrition incentive grants are to increase the purchase of fruits and vegetables by consumers participating in SNAP by providing incentives at the point of purchase. The goal of the GusNIP produce prescription grants is to provide either a financial or non-financial incentive to purchase or procure fruits and vegetables that members would consume to improve their dietary health, reduce individual and household food insecurity, reduce healthcare usage and costs. The eligible entities for nutrition incentive grants and produce prescription grants include nonprofit organizations and government agencies. All GusNIP grantees and applicants are encouraged to build partnerships and collaborations. One of the purposes of this program is to enhance those networks within our food system and our healthcare systems. That collaboration is essential to the success of these projects. And collaboration can be with partners that do not meet the primary applicant eligibility. So applicants may partner with academic institutions, other community organizations in the proposals that they prepare. Next, please. As stated before, the aim of all nutrition incentive grants must provide financial incentives to increase the purchase of fruits and vegetables by consumers participating in SNAP. They should also test strategies that can improve our understanding of how best to increase the purchase of fruits and vegetables by SNAP participants. And these strategies can include testing new technologies. Individuals that can participate in a grant that could be served by one of these grants for nutrition incentive grants must be participating in SNAP. And all nutrition incentive grant projects must operate through SNAP authorized firms and comply with the relevant SNAP regulations. And you'll hear more on that from our colleagues from the Food and Nutrition Service shortly. Next, please. Produce prescription grant proposals must prescribe fresh, whole, or cut fruits and vegetables to members of health plans. These could be financial or non-financial incentives that would increase procuring fruits and vegetables. Produce prescription grants must also provide educational resources on nutrition to their members, and they may establish additional locations where members can acquire fruits and vegetables. They must partner with at least one healthcare entity. Individuals can participate in a produce prescription grant project if they are a member of a low-income household that suffers from or is at risk of developing a diet-related health condition, and they're either eligible for nutrition assistance benefits or eligible for medical assistance benefits and enrolled under a state plan or waiver for that medical assistance. Next slide, please. Thank you. The nutrition incentive grants require a 100% match or a dollar-for-dollar match for what federal funds are requested. There are 3 different project types that are invited in nutrition incentive grants. The program area code for the pilot projects is FPP. These pilot projects that are just developing their programs are proposals that have less than 1 year duration, and where the proposed federal budget does not exceed $100,000. For these standard projects, mid-sized groups with a county to state scope, the program code is FIP. These projects may be up to 4 years in duration. Their federal budget cannot exceed $500,000. And for the large-scale projects, that program code is FLSP. These are projects of up to 4 years in duration, and the federal budget is more than $500,000. For the produce prescription proposals, no matching is required. Both pilot projects and standard projects are accepted. For both of these, the program code is PPR. The grant duration is maybe up to 3 years, and the funding requested could be $500,000 or less. Next, please. NIFA accepts applications all electronically through grants.gov. Within the grants.gov application package, you will also be able to find the NIFA application guide. All documents that are submitted to NIFA as part of a grant application must be in PDF format. This is important for applicants to check, because grants.gov is utilized by many agencies across the federal government, and some may accept other file formats. So you may not get an error from grants.gov. However, since NIFA only accepts PDF format attachments and grant application materials, if a document were to be submitted in another format, it would not be accepted by our system and would be as if it had not been attached in grants.gov. Next slide, please. When preparing your application, I want to be sure to highlight that there are page limits throughout that are strictly enforced. Project narrative specifically is limited to 10 pages of narrative and 5 pages of tables. It is to be prepared in Times New Roman font with 1.5 spaced lines. It may not be any more condensed than that. Within the 5 pages of tables, those tables may not be smaller than 10-point font. They may be single spaced, and those tables can be woven throughout your proposal in the narrative, or they could be presented only at the end. That is up to each applicant. And the 5-page limit of tables is inclusive of the recommended 3-page table to communicate the activities that will be used to achieve the project goals. If a proposal is going to be resubmitted, a proposal that has already been reviewed by NIFA and would be revised and resubmitted for this round, those proposals are also allowed 1 page to respond to the previous review, and that page would not count toward this 15 pages limit of narrative and tables. That is, however, only for proposals that have previously been submitted to NIFA. It's not for new proposals. And resubmitted proposals also need to take care to provide the proposal number of the prior submission. The application package also should contain a logic model, a sustainability plan, a data management plan, and the list of SNAP retailers. And those page limits are also shown here. Next. Within the project narrative, applicants must describe the community to be involved and the needs that the project will address, the organizations and communities that will carry out the project goals and intended outcomes, the activities to achieve the goals, the relationship of the project to the GusNIP goals and priorities, the evaluation plan for the project, the specific program and incentive information, the sustainability plan, and address that the project proposed is not going to supplant existing efforts. I want to be sure to emphasize that GusNIP proposals are for new, expanded, enhanced projects. They're not meant to displace activities that have a different funding source now with a federal funding source. For all nutrition incentive grant applications and all produce prescription grant applications, the evaluation plan must be inclusive of the core minimum data set that will be described later on. Those evaluation plans can always go beyond the core minimum data set, but must contain those minimum data points for the GusNIP comprehensive evaluation. Next slide, please. Next. As mentioned, there is a comprehensive evaluation for GusNIP, so any grantees are required to collect the core metrics for their grant type. Those data must also be shared with the Nutrition Incentive Training Technical Assistance Evaluation Information Center. The center, as a grantee, then aggregates those data through a central system and identifies success stories, best practices, and opportunities to enhance the field as a whole and advance the GusNIP program. Grantees are also required to provide reports in our report system. These are progress reports and financial reports. Next. The evaluation process that NIFA uses is a merit-based peer review evaluation process. The reviewers are selected for their expertise and their breadth of areas that they cover, from research and evaluation to the food system, farms, production, gleaners, extension efforts. And they will initially assess the strengths and weaknesses of the proposal, provide opportunity for discussion with other reviewers, and then the full peer review panel will come to a consensus on the merits of the application. Next. The evaluation criteria that the peer review panel uses are the evaluation criteria in the RFA. It is in your best interest to utilize those criteria when you're preparing your proposals. The exact same information that is in the RFA is the information that the peer review panel uses. Next. I do want to also note for everyone that the peer review process takes from 6 to 9 months to complete before award notifications and determinations of funding are communicated. NIFA will be communicating as much as possible, but we do appreciate your patience. Thank you.
Okay, so we'll do a bit of a handoff here. Thanks, Mallory, for that. My name is Beth, guys. I work in the awards management division. So you just saw the timeline there of when your applications will be received and reviewed. What we're going to talk about in the next couple of minutes are things that would come into play later in the application process. Perhaps we are going to have some additional questions, clarifications. That's when you'll meet our team for the first time. But before we even get to that stage, we want you guys to feel confident when you're preparing your applications. So we are going to go through some eligibility pre-award requirements, indirect cost recovery, match requirements, guidelines, definitions, talk a little bit about cost principles, And then, really what a successful looking budget and justification looks like from our standpoint when we're reviewing those cost principles from an administrative point. Next slide, please. Thanks. So this is duplicative of what Mallory has shared. Again, just a reminder of who is eligible to respond to this RFA. You can go to the next slide, please. And an additional clarification that as part of that just-in-time information, or as we get closer to funding successful proposals, that we do ask for additional organizational management information. So you may be asked later in the award processing making process to provide additional information regarding your financials and internal controls. And that is in accordance with NIFA policy and of course 2 CFR 200, 302, and 303. So we may in some cases be asking to review 2 years of audited financial reports or certified balance sheets, details of your cost accounting system, policies on how your salary compensation rates are determined, and your bylaws, etc. So if we do ask for this type of information, we do appreciate when it can be kind of turned around in an efficient manner so that we can continue with our processing of awards. Next slide, please. The GusNIP program does allow for full recovery of indirect costs based on current negotiated rate that's established by your cognizant federal agency. If you don't have a negotiated rate at the time, you do have options available to you. You can request to negotiate with your cognizant agency. And that, of course, is whatever federal agency that you're doing most of your business with or receive most of your federal funding. So it could be NIFA if GusNIP is your primary federal award. It could also be Department of Health and Human Services or Department of Defense. There's several other agencies that could act as your cognizant. And we can help you make that determination if we need to. You can request the 10% de minimis rate, which is a 10% modified direct total cost. There have been updates to the uniform guidance within the last 2 to 3 months about the de minimis rate, and it is to be of service to you. In the past, if you had a negotiated rate and then that rate expired, you were not allowed to go back and use the de minimis rate, but that has since changed. And we do now, if you have an expired NICRA or a negotiated rate, you can request to use the de minimis rate. Or you can also waive indirect costs altogether. And if you have questions about IDC indirect cost process, you can always refer to our website. We have frequently asked questions and can help walk you through the process of preparing for negotiation if that's something that you would like to do. Next slide, please. This also is duplicative, but important to see multiple ways sometimes. There is a 100% or dollar for dollar match in the pilot project, implementation project, and large scale project of the nutrition incentive grants. And there is no match required for the produce prescription. Next slide, please. There usually are quite a few questions regarding matching, and we want you to feel confident when you're preparing your application and what we consider to be a quality match. And so we want to provide you with the information that we will use when evaluating your match. And we concentrate very heavily on the uniform administrative requirements, specifically Subpart D, 200-306 cost share cost match, and Subpart E, which are the cost principles. And we'll step through some of those common cost principles together here on this webinar, and you can learn how you can reference those when you're preparing your applications. Next slide, please. Definitions. We will accept cash match, in-kind contributions, and third-party matching. So you can see each of those here laid out. Cash match, recipient's cash outlay, including outlay of money, contributed to the recipient by the non-federal third party. So it might be a cost to purchase an item of equipment, or salaries or staff time, purchase of supplies, travel supplies. All of those would be quality matches. In-kind contributions are also accepted. So that's the value of non-cash contributions of property and services. And then third-party matching, which is any contribution to the project by an organization other than the recipient. It is important to note with regards to third-party matching that for this program, salaries for for-profit organizations are not allowed for in-kind match. Next slide, please. Some tips when you're thinking about your matching. We will be making sure that all of these are verified, or at the time of award, you need to have your entire match secured. Costs must be incurred specifically for the project and during the project period. So you need to make sure that your matches are both project bound and time bound. They must be for costs that are normally allowable under the cost principles. That's the Uniform Guidance Subpart E, or that are specifically identifiable and directly benefiting the project. We would evaluate those very closely at time of review. What is not an acceptable match? Funds provided by another organization for use on another similar project. We call that double dip, so it needs to be unique to this project. Also, funds that are provided by another federal agency are not an acceptable match. Income expected to be earned during the project is not acceptable. Again, the entire match must be secured at the time of award. Indirect cost rates applied beyond the federal portion of the award, so those are not allowed, as well as contingency costs. Again, they must be secured at time of award. Next slide, please. Cost principles subpart E 200, 420 through 475 are that's going to step you through many different items that you might include in your budget, as well as give you information about how you can show if these costs are reasonable, allowable, allocable costs. That's what we're going to use as our threshold when stepping through your proposal before award to determine if these costs are indeed allowed. Salaries are very common. So in your justification, we want you to provide an annual or hourly rate of pay, the time of commitment or effort, and then of course the tasks to be completed. Salary rate should be at the normal rate of pay for that employee or the job category. And again, of note, salaries for for-profit companies may not be used as matching in this program. Volunteer staff, you might also be looking to engage volunteers. It's important to know that the time supported should be at the same level of documentation used by if you're reporting someone's salary or wage. And the rate of pay is based on the work related to the project, not the volunteer's rate of pay at his or her employment. So an example might be, if the city's district attorney would like to come volunteer and as part of your garden and your effort, that match or that volunteer time would be based on what it costs to do the gardening, not any sort of legal activity that would be his or her usual rate of pay. Next slide, please. Office rent, if there's a need for an office away from the main facility, you may use that as a federal direct cost, or it could be part of your match. But we do need to see an explanation on why you need to rent, the monthly rental costs, usage information. The facility cannot be owned by the recipient organization, and you can't use that as part of your indirect cost pool. That would again be another example of double dip of federal dollars. And then the rent must be prorated to the project if the space is shared or you're going to not use it for the full amount of time. So we will be looking for and asking those types of questions during our administrative review if we cannot reasonably determine it from your budget and justification. Donations, the basis for determining values of donations must be verifiable from the records of the recipient, subrecipient, or contractor. And the methods to determine the value should be included in the records. So again, this is probably more related to a match situation. If someone is donating a vehicle or something for you to use to achieve your goal, we will be looking for information on how you came to the value of that vehicle and that it be appropriate and reasonable then that a prudent person would find it to be of similar value. Next slide, please. Travel costs. If you are traveling during the course of your program and you're going to propose dollars be used for travel, that we need to include information on the destination, the number of trips, number of travelers. Materials and supplies is similar. Please give us as much detail as you can about what supplies you need and why you need them. And then again, with meeting space, if you're going to be renting a space in a community center, hotel, or facility, it's important to note that if that facility does not normally charge for use, the costs of rental would be deemed unallowable. So you need to ensure before using it as a match or before you seeking federal dollars that it is a usual situation for that space to be incurring a rental fee. Next slide, please. All right. And many of you have probably seen this before if you've applied to awards, in particular the GusNIP program, but we do rely on the R&R federal, non-federal match budget form. That'll be a part of your application. And there will be a column dedicated to federal dollars and another for non-federal dollars. And we do ask that you be very specific in your budget justification and submit 2 budget justifications back, one and then the other. First the federal and then the matching. Please don't combine your justifications into one narrative. It's confusing for us when we go through it. So our preference is that they be very clear and distinct. And any level of detail that you're using to summarize and justify your federal funds, we're going to be looking for that same amount of detail and using that same scrutiny with matching funds. So please be very specific with your matching funds. And if we do find an expense to be unallowable on the federal budget, you can assume that it was also unallowable in matching and vice versa. And if we do come across something, we will reach out and have a conversation and try to help determine if we can move those federal dollars that were deemed unallowable to another category or help you identify another match source if required. Next slide, please. I believe this is my last one, but it is important to note projects that are unable to meet the matching requirements will not be funded, or the funding may be reduced. So remember, it's dollar for dollar. So we will be looking for every single federal dollar to be accompanied by a matching dollar if you're applying to one of those programs. And that a complete list of matching sources must be secured and maintained at the grantee's organization, and that it is your responsibility to secure and expend matching funds in accordance with award terms and conditions. And we do reserve the right to perform random desk audits, site reviews, and seek clarification and review that matching documentation and expenditure reports. I believe that's all I have. Let's check the next slide and we'll pass it off. Thanks.
Michael Garcia. Are you muted?
Sorry about that. Yes, I was trying to unmute myself, and thank you. Thanks so much. Hi, good morning and good afternoon. Again, my name is Michael Garcia, and I work with the Food and Nutrition Service, or FNS, and we oversee the Supplemental Nutrition and Assistance Program, or SNAP, at the national level. Next slide, please. So this is just some of the information I just gave to you. It's also got my contact information, which I'll repeat again at the end of the presentation, the email address for our GusNIP inbox. Next slide, please. So just a bit of an overview here on the presentation. I'll be talking a little bit about the purpose of GusNIP, give you some background information, why your store or farmer's market should participate in GusNIP. I'll talk about SNAP eligible food, then move on to GusNIP qualifying fruits and vegetables, explain how incentives work, talk a little bit about the SNAP equal treatment rule, also talk about some sales tax and refund information, how to participate in GusNIP projects and apply for SNAP authorization as a retailer, and then go on to Grantee-Firm Memorandum of Understanding, or the MOU, and then talk about the grantee and retailer responsibilities. And then I think we're going to save the questions until the very end of the presentation. I think when we've all gone through our slides. Next slide, please. So as Mallory mentioned a little earlier, I apologize, I'm kind of repeating some of her information here. So the purpose of GusNIP, or the Gus Schoonmaker incentive program, is to support projects that increase the purchase of fruits and vegetables among low-income consumers participating in the Supplemental Nutrition Assistance Program, or SNAP, by providing incentives at the point of purchase. All right. And next slide, please. So just a little bit of background on who we all are. We're all under the USDA umbrella. But then within or under that umbrella, you've got FNS and you've got NIFA. So FNS, which stands for, again, as I said before, Food and Nutrition Service, and NIFA, the National Institute of Food and Agriculture, collectively manage GusNIP. So FNS is responsible, again, for SNAP at the national level. We also handle SNAP retailer policy and policy related to the electronic benefits transfer, or EBT card. It includes providing SNAP retailers guidance, and we help them. We oversee the retailer authorization and compliance within SNAP. And then NIFA, what they do is they manage the GusNIP program overall. They provide funding to grantees, and they provide support and other types of guidance to grantees. And then what we'll do too at FNS is provide grantees maybe technical assistance, for example, with helping them through the retailer application process, and help them sort of navigate that process. Next slide, please. So a little more about the background. So the Food Insecurity Nutrition Incentive, or FINI, grant program was established as a pilot under the 2014 Farm Bill. And it was established for 5 years. I'm just providing you guys a little bit of history here, with a budget of $100 million. So then we jump forward to 2018. The 2018 Farm Bill renamed FINI to the Gus Schoonmaker Incentive Program, or GusNIP, and it now has a budget of $300 million, and it's a permanent program. So throughout this presentation, I'll be talking about GusNIP, but that also includes some information related to any ongoing or former FINI grantees. So some of this may touch some of you. Okay, next slide, please. So this is geared a little more towards retailers, but I think this is good information for grantees also. So why should your store participate in GusNIP? Well, there are 3 main reasons for it. First, the GusNIP program or GusNIP grantees promote your store by advertising their grant projects, including the address of their partner retailers. And this positive press exposure may bring new customers to your store or to your farmer's market, and it can help to expand your customer base. Another reason is that retail stores should participate in GusNIP is that the grants project generally increase overall sales in fruits and vegetables, especially with fresh produce, is what we've seen. And then finally, By participating in GusNIP grant projects, you'll assist households to stretch their SNAP benefits and help improve the overall health of your customers and of your community. Okay, moving on to the next slide. And I'm not sure if are you able to open up, Letha, this link for me here, this GusNIP incentive locator? Let's see if that opens. If it doesn't work, I guess I should have tested that before. I apologize. Well, while we're waiting for that link, I'll tell you that also FNS promotes the participation of your firm on our external incentive webpage, which is found at this link. And basically what it allows is for a household to maybe put in their city or their zip code and locate SNAP authorized firms or farmers markets located near them that offer the incentives, the GusNIP incentives. So sorry about that. Maybe, yeah, I think we can just move on. That's all right. We can move to the next slide. Okay, so GusNIP qualifying fruits and vegetables. So under the SNAP eligible foods umbrella are the GusNIP qualifying fruits and vegetables. So the definition of GusNIP qualifying fruits and vegetables for nutrition incentive grants includes any variety of fresh, canned, dried, or frozen whole or cut fruits and vegetables without added sugar, fats, oils, or salt. Some examples of GusNIP qualifying fruits and vegetables include, but they're not limited to, for example, you have frozen spinach would qualify, fresh apples, sun-dried tomatoes, 100% orange juice. So juice, but it does, excuse me, so juice, but it does have to be 100% juice. And canned artichoke hearts, so long as these products contain no added sugar or fats or oils or salt. So those would be acceptable. SNAP eligible seeds and plants intended for cultivation and consumption. So for example, tomato seeds or tomato plants would be eligible, and fresh herbs. So for example, fresh basil or thyme or mint, those are also considered GusNIP qualifying fruits and vegetables. Okay. And I'm wondering here if I skipped a slide. I think I did. Do you mind going back up one? I may have, let's see here.
I think it was the eligible food slides, Michael.
Yes, right about that. And I unfortunately did not number my slides. So do you mind going back up one more? Oh, I might have left it out, huh? All right, you can go back down.
Going forward, go forward a few slides.
Yeah, it might just be forward. Let's see here, continue. Go forward one more and one more.
It's this one right here.
Sorry, folks. Anyway, yes, SNAP eligible food. So, so the Food and Nutrition Act of 2008 defines eligible food as any food or food product for home consumption by SNAP households. So this includes, for example, as I mentioned earlier, seeds and plants that produce food. I gave you the example of tomato seeds, tomato plants. Some prohibited items are alcoholic beverages, tobacco products, hot food, and any food sold for immediate consumption in the retail store or on the premises, for example, of the farmers markets. Those are prohibited from being purchased with SNAP benefits. Let's see. So non-food items, again, are ineligible from being purchased with the SNAP benefits. And, non-food items can include, for example, pet food, soap, paper products, etc., those types of things. So those, again, are ineligible. Let's see if we could move on to the next slide, please. And I think we covered that. Thank you. And then we'll move on to the next one. So here I talk a little bit about eligible foods and the incentive. So basically, a financial incentive disbursement may only be redeemed for SNAP eligible foods. So in other words, when you give out an incentive, it can only be used for a SNAP eligible food. And financial incentives may only be earned by the purchase of SNAP eligible food. So you have to, the household must make a SNAP eligible food purchase, and then once they receive the incentive, it must be used for a SNAP eligible redemption, or it must be used to redeem the incentive on the SNAP eligible food. All right, next slide, please. So how GusNIP incentives are triggered and delivered. So SNAP households must spend SNAP benefits in order to earn incentives under GusNIP. Fruit and vegetables may be involved on at least one end of the transaction. The financial instrument for delivering the earned incentives can be in the form of tokens, script, coupons, or a loyalty card, for example. Under the GusNIP grant program, there are 3 allowable models for incentives, incentive disbursements and redemptions. And these are the allowable models. So number 1, any SNAP eligible food triggers earned incentives, which can then be used to purchase additional fruits and vegetables. The second model is fruits and vegetables are purchased and they trigger earned incentives for the purchase of any SNAP eligible food. And then number 3 is fruits and vegetables are purchased and it triggers earned incentives for the purchase of eligible fruits and vegetables. And this is sort of what we prefer to see, this last model, number 3. So someone buys fruits and vegetables, and that triggers the incentive, and then that incentive that they receive is used again for fruits and vegetables. Let's see here. And the next slide, please. So SNAP equal treatment. SNAP regulations require that SNAP households receive treatment equal to that received by other customers at all retail, food stores, and farmers markets that are authorized to participate in SNAP, except with the exception that sales tax may not be charged on eligible food purchased with SNAP benefits. The SNAP equal treatment requirement prohibits both positive unequal treatment, such as incentives, and negative forms of unequal treatment or discrimination. Because the statutory language of the 2018 Farm Bill requires GusNIP grantees to provide incentives specifically to SNAP clients, the equal treatment provision does not apply to GusNIP grantees for the purpose of providing incentives under the grant. Okay, and then we'll move on to the next slide, talk a little bit about refunds. So if you're in a situation where you have to do a refund, refunds for any food purchased with SNAP benefits or with tokens can never be made in cash. Providing cash refunds for SNAP tokens or food purchased with SNAP benefits is considered a serious violation of SNAP rules and can have lasting legal ramifications for any firm engaging in such practice. Refunds of food purchased with SNAP tokens and SNAP benefits must be returned to the SNAP household's EBT card through a refund transaction on an EBT POS machine. Okay. So earned GusNIP incentives may neither be refunded with cash nor refunded onto a SNAP household's EBT card through a refund transaction on an EBT POS machine. Incentives received through a GusNIP grant are intended to increase the consumption of qualifying fruits and vegetables and must be spent accordingly. Okay, next slide, please. So how to participate in GusNIP. Retailers, for example, farmers markets, direct marketing farmers, convenience stores, grocery stores, interested in participating in GusNIP can, 1, partner with a GusNIP grantee. So if there's, for example, a grantee that is awarded a grant maybe last year and they're currently operating, we can assist you in contacting them to participate. Or you can also, firms can look to participate with this latest round of upcoming awardees. Second step would be to apply online for SNAP authorization at one of the on our website, we have a couple links to the retailer application process, and then we also have a link below to the farmer producer application, and those again are on our website. If a retailer is authorized to participate in SNAP, the grantee can then submit partner information and the MOU to FNS via the GusNIP at usda.gov email inbox for review. So again, once you have received your award, you've made a commitment with your partner firms, you've signed the MOU, you would then provide that to us for review, and then we would just let you know if we have any questions for you. And then number 4, FNS reviews firms for participation in the incentive and lets the grantee know if your firm can participate in GusNIP. So overall, SNAP authorization in general takes maybe about 30 days to process. It can take a little longer, but this entire process with, the MOU process, signing the MOU, getting us the MOU, going through authorization and getting us the MOU can take about, that entire process can take about 60 calendar days. So it's important that GusNIP grantees get started early and work closely with their partner firms to move things along. And if you're a retailer looking for a GusNIP grantee in your area, again, you can reach out to us at the GusNIP email inbox, and we can help you locate grantees in your area. Okay, and then next slide, please. Okay, so the Grantee-Firm Memorandum of Understanding, or the MOU. So the grantee must have a signed MOU with each of its partner firms. Basically what this does is it codifies the relationship between the grantee and the partner firm and outlines prohibited practices, and it details the responsibilities and expectations between the grantee and the partner firm. So again, regarding the MOU, GusNIP grantees must work with their prospective firms to obtain an MOU before the firm can participate in the GusNIP grant project. The MOU must be signed and dated by the grantee, project director, and the firm's owner. If the grantee is working with a chain of centrally owned and operated firms, then one MOU that includes all the relevant information for the various stores will be sufficient. And more details about this are also in the RFA, as just a reminder. That's all covered in the RFA. Or if you have any questions, you can always reach out to me. Just send me an email. Okay, next slide, please. So Grant-Firm Reporting. When the grantee is ready to report their partner firms to FNS, these are the steps that can be taken. So again, whenever transmitting any confidential SNAP firm data to FNS, it must be password protected. The preferred method is listed below. So what you can do is email me a password protected electronic copy of the MOU along with a password protected spreadsheet listing your partner firms to the GusNIP email inbox. This is especially helpful if you're working with a lot of firms and you've got a really big program with just, like I said, a lot of partner firms. So this kind of just helps us track the MOU, it helps us track the MOUs and also find the pertinent information for participating firms. So number 2, use the following spreadsheet template to report partner firms. And then below that, number 3, send a separate email to the GusNIP inbox with a password for the encrypted MOU and the spreadsheet. And basically what we're asking for with this spreadsheet template is, the name of the firm, the name of the grantee, the FNS number, the address of the firm, the participation start and end dates in your grant. So this again is all very helpful to us and helps us match firm participation with just making sure that they're SNAP authorized, and then also just matching that with the MOU. Okay, moving on to the next slide. Okay, so for projects transitioning from FINI to GusNIP, so recent FINI grantees transitioning to a GusNIP grant award may continue to offer incentives without pause if the incentive program is unchanged. Grantees are still required to submit MOUs and lists of partner firms to FNS per the terms of the GusNIP RFA. And then again, the password protected MOUs and list of partner firms can be sent to the same email address I mentioned, the GusNIP at USDA. And then again, we do kind of take that same process where we will just review the MOUs, look at the firms, your partner firms, and then just let you know if we have any questions. All right, next slide, please. Report changes. So please, GusNIP grantees, please notify FNS and NIFA when the primary point of contact for your project has changed. We require a point of contact in order to communicate with the grantees regarding any projects or any questions we might have. Also be sure to report to us any changes in your incentive project. We'd like to be aware of that. And again, at the bottom of this slide is the GusNIP inbox, and then I've provided Mallory and John's email addresses. Okay, and let's see. Next slide, please. Okay, so grantee and retailer responsibilities. Grantees and their participating firms are expected to comply with all of the policies and requirements outlined in the RFA document, as well as GusNIP and SNAP policies. If you have a SNAP or EBT related question or questions about compliance, please feel free to email me. And then next slide, please. Healthy food options have a healthy food options have a positive impact. So FNS wants to help promote the positive work that GusNIP grantees, retailers, and communities are doing to assist families in needs of healthy food and produce. Therefore, it is important for grantees and their partner firms to work together to report their project and firm participation to FNS using the format discussed in the earlier slides so that your great work can be counted and promoted. Thank you very much. And then again, thank you for your time, and just here are some links for some additional information, but we can go over that a little later on. And then next slide is for questions, but you know what? I think we're going to cover questions at the very end of the presentation, and thank you so much.
Dina Nugent.
Hi, everybody. My name is Dina Nugent, and I'm a research scientist at the Gretchen Swanson Center for Nutrition, a nonprofit independent research institution located in Omaha, Nebraska. I am part of the team that leads reporting and evaluation for the Nutrition Incentive Program Training, Technical Assistance, Evaluation, and Information Center, herein referred to as NDAE, and we serve as the national evaluators for all existing and incoming GusNIP projects. I have with me Noah Fulmer, who is the Director of National Partnerships at Fair Food Network, a nonprofit organization based out of Michigan that is largely responsible for the technical assistance and innovation for GusNIP projects. And he will introduce himself further in just a few minutes and tell you about the services that they provide to GusNIP grantees more broadly, and also specific to you and this application that's due on March 16th. Next slide, please. The Nutrition Incentive Hub is a coalition of partners created by the GusNIP NTIE Center that supports nutrition incentive and produce prescription projects. The NTIE Center is funded through the cooperative agreement, and it is supported by GusNIP and funded through the 2018 Farm Bill. Next slide, please. This organizational chart is just to show you the structure. So the GusNIP NTIE Center is led by Gretchen Swanson Center for Nutrition. It's highlighted in yellow, and our project director is Dr. Amy Yarrow. In partnership with Fair Food Network, we assembled the Nutrition Incentive Hub, which is a coalition of practitioners, grocery, and farmers market experts, researchers, and evaluators from across the country. So really, for simplicity's sake, the only thing that's important to know with this is that there's basically two arms or branches to the Nutrition Incentive Hub. The first arm is a reporting and evaluation arm, and that's the one that's led by Gretchen Swanson Center for Nutrition and our many consultants based in academic institutions from California, Colorado, Montana, and Michigan. This is shown on the left side of the chart. On the right side of the chart is the technical assistance and innovation arm or branch, and this is led by Fair Food Network and is supported by multiple fantastic farm direct and brick and mortar retail experts, including Farmers Market Coalition, Michigan Farmers Market Association, and Ecology Center on the farm direct side. And on the brick and mortar side, we have the National Grocers Association Foundation. And we also have some wonderful consultants highlighted in red on the right side of the chart. Next slide, please. This slide shows the current funded GusNIP projects to date, starting from 2019. So far, there are 53 funded projects, including the NTAE, which is us, from across the country. And this represents 33 nutrition incentive projects and 19 produce prescription projects. The map shows the state where the project was funded, but does not represent the reach of various programs. So just know that some of these programs reach across states, and this is just the state of which their organization is headquartered. Next slide, please. These are just some acronyms that we thought it'd be helpful to put in the chat box because you're probably going to be hearing them a lot. And it's a lot easier than saying some of these long-winded terms. So you could go on to the next slide. And now we're going to take a few minutes, go to Noah Fulmer at Fair Food Network, and he'll talk about technical assistance and innovation.
Thank you, Dina. Nice to be with everyone today. And just to briefly go to the next slide, please. You know, at Fair Food Network, as Dina mentioned, we lead the technical assistance and innovation piece of the Nutrition Incentive Hub. And that covers every sort of question that you might have as an applicant to the GusNIP program or questions you have as a grantee of the GusNIP or FINI programs. We are really excited to be able to answer any question. No question is too silly. And so we, are able to cover topics ranging from the planning and strategic thinking behind the concept of your nutrition incentive project to nitty-gritty questions around working with farmers markets or other types of farm direct retailers to supermarkets, grocery stores, corner stores. There are experts, as Dina mentioned, that we work with as part of the hub that are really equipped and versed in all of the types of details that the stores go through in terms of operating their retail locations and what considerations they might have in terms of implementing a program like GusNIP at their store or their farmers market. So feel free to reach out about questions of those sorts. When it comes to produce prescription programs, we have additional resources. It's not just about the nutrition incentive side of things. And when you're thinking about partnerships and ways to bolster the incentive work that you're doing, there are also many resources about the nutrition education and SNAP-Ed dimensions of this work, which are so important. If you have questions around marketing and promotion of your GusNIP programs to community members and participants, there are resources available that can accelerate your ability to use language that is ground truthed with different groups that have been participating in GusNIP programs to date, as well as think creatively about marketing strategies that have been used elsewhere. We also have folks on the team here at the Hub who have been doing a lot of work incorporating DEI, diversity, equity, and inclusion into GusNIP projects. And from the side of matching funds and fundraising, whether that's from philanthropic sources, from state or local government, from in-kind partners, those are all conversations that we're happy to have with you as we've seen them work to make so many GusNIP and FINI projects come to life in years past. And really, any questions you have about program administration, GusNIP applications, again, there's nothing too silly or too small. We welcome all sizes of questions. And so in terms of the next slide, please, Litha. Thank you. In terms of how to reach us, there's a couple of different types of resources that we have available. And so you can start by perusing the nutritionincentiveHub.org website. There's a link right there that gets you to some resources that have been put together in the past around GusNIP applications. If you're applying right now, the rest of the website has additional resources in terms of those implementing GusNIP programs. If you'd like to get started with other kinds of hands-on technical assistance, feel free to reach out by email to ta@nutritionincentiveHub.org. That's all one word. And for the TA email address, we're happy to either set up a half-hour to talk with you about an upcoming proposal you'd like to put in for the March RFA, or we can also get you hooked up with some resources that we have online, whether that's forums where you can get answers to your questions from a variety of experts around nutrition incentive topics, to being on a weekly list about webinars that are really focused on practitioners running incentive programs and sharing best practices. And along those lines, there will be a produce prescription focused webinar coming up I guess that's next week, February 4th at 2 p.m. Eastern time, and you can register on the nutritionincentiveHub.org website for that. But yeah, please feel free to reach out with any questions to the ta@nutritionincentiveHub.org email address. And if we can't answer the question directly, we'll quickly route it to someone who does have an answer. And we just feel so lucky to be in partnership in this work with Gretchen Swanson Center and the wonderful folks at NIFA who bring the program to life. And yeah, look forward to working with many of you over the coming weeks and months. Thanks, Litha, and thanks, Dina. I think it's back to you, Dina.
Great, perfect. So next I'll talk about reporting and evaluation requirements for GusNIP grants, as well as some of the services we provide to current and prospective grantees. Next slide, please. Because of this requirement for all GusNIP projects to complete the evaluation set forth by NTA. Oh, this is the next slide. Let me see here. Yeah, we can start on this one. That's fine. There was a budget slide, but we could go with this one. So the NTAE project evaluation is required by all projects except for pilot projects. So that's important. Don't want to scare the pilots that are out there. Next slide, please. So all the GusNIP evaluation requirement is that all GusNIP projects will be required to cooperate with NTAE by supporting implementation of evaluation requirements, meeting periodically with staff from NIFA, FNS, and the NTA centers and other GusNIP grantees, facilitating access to or providing documentation of project implementation, operations, costs, and outcomes, and facilitating site visits and interviews with project staff, partners, and program participants if necessary. And this language is found in the RFA on page 28. Next slide, please. It further states that all projects must include an evaluation of whether the project met its goals and objectives. Project evaluations must follow USDA guidelines to ensure appropriate level of comparability of methods, outcomes, and measures. As discussed below, a higher level of rigor will be expected for the large scale and the PPR or produce prescription evaluations. All projects except for the pilots will be required to cooperate and contribute core data to the NTAE. Next slide, please. Here we go. This is what I was looking for. So because of the requirement for all GusNIP projects to complete this evaluation, we highly recommend that all applicants add a budget line item to include evaluation, and that at least 10% of the budget be allocated for evaluation. And next slide, please. So this slide came about because we get a lot of questions on why the metrics that are required are required. Why did we choose, what we did for all grantees to contribute to. So first, a little bit of history. The impetus for the creation of the NTIE and the Nutrition Incentive Hub came from gaps that were identified from previous years of FINI. There was a need to have shared measures, which goes back to that highlighted phrase, comparability across all programs. There was a need to have shared measures as well as coordinated technical assistance across grantees. And I can explain a little bit further. So first, in general, shared measures are needed to advance understanding of nutrition incentive and produce prescription programs. GusNIP is seen as larger than the sum of its individual projects. The NTIE needs to show overall impact nationally, and the only way to do that is to measure programs the same way. So far, there is little or no existing evidence for the impact of either nutrition incentive or PPR programs on a national scale. We need to demonstrate meaningful improvements in program objectives to build the case or build support for ongoing funding. Next, shared measures. Nope, sorry. I'm just saying next. Builds capacity for programs new to evaluation, establishes a community of practice among practitioners. So essentially, for the programs that might be a little bit newer or lower capacity, it eliminates the guesswork, especially for these are practitioners that generally, not so much research may not know about evaluation. And this will provide the validated gold standard evaluation instruments to assess primary outcomes, which are food, fruit and vegetable consumption, and food security. The Nutrition Incentive Hub also provides a single source of information or a one-stop shop for resources that all grantees and prospective grantees can access in terms of reporting and evaluation and implementation. Fourth, it makes meaningful comparisons between projects to understand moderators of success or components of success. For example, if fruit and vegetable intake is measured differently across projects, then we can't compare programs that perhaps employ different types of nutrition education to know what type of nutrition education is most effective in changing food behaviors. Fifth, it provides funders with evidence on effectiveness. Funders want to know if a program works. They also want to see how their program might work compared to others. So using these gold standard evaluation practices reassures funders to know that their money is well spent. Sixth, and perhaps most importantly, it provides results to support policy actions that strengthen public health impacts of nutrition incentive and produce prescription programs. The Farm Bill is one source of funding. However, if the goal is to expand upon these projects nationally, as has been proposed, for example, for all SNAP and Medicaid participants, then a strong evidence base must be built. Further evaluation also needs to show benefits to society, such as local economic growth and reductions in healthcare utilization and costs. The business case must be established, and a shared comprehensive evaluation aims to do exactly that. Now you can go to the next slide. Thanks. So this is how we established the core common metrics, and it really did take almost a year to really hone in on what was feasible. The process for establishing these core common metrics, or the core minimum data set that you might see in USDA or language like the RFA, was very multifaceted. We started with the RFA requirements, which are rooted in the 2008 Farm Bill. Many of the firm level metrics that I will be talking about in a couple minutes are the same. They're exactly the same as what was required under FINI. We weighed various FINI requirements by also looking at what grantees had proposed in their narratives and understanding any metrics that have been used commonly in the past. We solicited input from subject matter experts, including our advisory committee, consultants, core partners, and others. We also considered the validity and reliability of available instruments, what has been previously used, especially among low income or under-resourced populations. And most importantly, we considered the capacity of grantees to collect core metrics. So sometimes it meant choosing a less robust option because it would be too burdensome. And that's exactly what we did. All of this is really to say that we used a bottom-up approach, taking into consideration the multitude of factors at play. Really selecting the core measures is the balancing act, which you see on the right, of all of these factors. And ultimately, we chose the survey modules and tools that have been used in low income and low literacy populations specifically, as well as tools that have been used in national surveillance systems that are widely tested and widely used, such as NHANES. Next slide, please. So there are two basic components of the required evaluation. There's the participant side, and then there's the firm level side. For the participant side, our main outcome is fruit and vegetable intake and food security. So it's a survey for all, again, all GusNIP grantees except for the pilots have this survey. This, what you see here is the required, it's not the required participant survey, but it shows you an example of some of the questions. The main outcomes, as I said, are fruit and vegetable consumption and food insecurity. The survey is approximately 32 questions and takes about 30 minutes to complete, and that's on the long end. It's probably 15 to 30 minutes. The other constructs are shown under the core metric columns to the left. And in the chat box, if not already, we can put the full survey, the link to the full survey, and then there's also with that rationale on why we chose individual survey modules and questions. And once your application is accepted, we'll go over this again, and we'll go over it more in detail of what these questions are. Next slide, please. So the number of surveys that are required across all grantees are based on the ability to detect a quarter of a cup per day difference in fruit and vegetable intake. So what that means is for GusNIP projects that are a little bit smaller, we ask for about 100 intercepts. So these are cross-sectional surveys done at one time point throughout the year. But your project is multiple years. So for every year you have to, add another 100, just so everyone's aware for the nutrition incentive programs. Same with GusNIP large scale projects. It's 150 subsample cross-sectional throughout the year, every year. For produce prescription, it's a bit different because we ask for a pre-post or a longitudinal assessment. So what we're asking for produce prescription projects is 100 to 130 total. And within these various, we say cohort based because depending upon the type of grantee you are, you might have 5 or 10 different produce prescription programs going on under the umbrella of your grant. So it really just depends. So we ask for each program within the larger program to do 100 to 130. Next slide, please. And these are the institutional or firm level core metrics. These metrics are reported. What that means is that they're reported by the grantee or the firm, otherwise known as the institution. So these metrics are reported on a quarterly basis, and it's pretty much exactly as stated in the RFA. And we can also put a link in the chat box that can link you exactly to the firm level metrics as well. But most of these are not a surprise to incoming grantees because it's listed in the RFA. Next slide, please. So this is not meant to scare you. This is not a requirement. We don't require all PPR programs to do this. What this is showing you is that with the 2 years of programs we have right now, or projects, 2019 projects and 2020 PPR projects, across all of them, this is what some of our grantees are collecting. So what we ask is if within the healthcare organization, if you're collecting any of these metrics, that we want to work with each grantee to understand data extraction and impact on these outcomes. We know it's difficult to work with electronic health records. So we're wanting to learn this in order to understand the best practices for this in the future. I think that's enough said on that. Next slide.
Dr. Nugent, we have only less than a minute left now.
Okay, next slide. Last slide. And the last thing is that this is the final component of evaluation requirements. All projects will need to go through a local IRB process. IRB protects the rights, privacy, and welfare of human subjects recruited for research and evaluation. Nutrition incentive projects are generally exempt if personal identifiers are not collected. The thing to know is projects need not have applied or been approved prior to GusNIP award receipt. We can help you through this process if needed, but just know that you will have to go and apply to an IRB, and it'll either be exempt or do the full review. Next slide. I think that is, lastly, these are resources. So all the things that I've talked about, if you go to that top link, and you see the orange highlighted, the dots, you want to kind of be in those three areas, those three boxes. All of the information I've just talked about, it has a lot of material in there. So I suggest that any prospective grantee look through that. Next. And then these are some of our services. And what I wanted to say about that is it's not limited to current grantees. If you need any advice on all of this, feel free to email us. I think the email we'll use is evaluation@Nutrition Incentive Hub, and we'll put it in the chat box, but please feel free to contact us if you have any questions on your application or anything dealing with reporting and evaluation. Next slide, I think that is it. Yep, and that's the email right.
Okay, thank you all. And for the participants, we will open a poll right now, just these two questions. Please answer this, and we will open the question and answers after that. Thank you.
Yeah, Litha and Jahan, feel free to please go ahead and start moderating questions so that we can address them in a timely manner.
Okay. Jahan.
Thank you, Mallory. Hi, everyone. My name is Jahan Koo, program specialist with NIFA, and I'm trying to moderate questions. And I see one question that has a lot of feedbacks.
Jahan, let's take them in order, please.
Oh, okay, sorry. So let's go from the top. All right, first question would be, well, again, the slides and the webinar link will be posted to the GusNIP website. And
I can show that.
okay, first question would be for Mallory. Is there the possibility for a multi-state project at the pilot or standard project stage? We are interested in testing a provider that aims to be nationwide, not just one state.
Sure. So I'm happy for you to contact me to give me more context with what you've shared. It sounds like a standard project stage could be appropriate. It's important that whatever program area you apply to, that you're responding to what is in scope for that program area. So feel free if you want additional clarification to reach out specifically.
Next question would be for Michael or Mallory. The question says, is it possible to apply for a projecting blending SNAP and FVRX fruits and vegetable prescription pilots?
So this is Mallory. I'll go ahead and take that one. So you are certainly may submit a proposal. You do need to be clear which program area you're submitting to. So if you're submitting to a nutrition incentive standard project, then your proposal is going to compete with other nutrition incentive standard projects and needs to meet all of those requirements. If you're going to submit a produce prescription standard project, the same would apply. But you certainly do have that flexibility.
Next question is for Mallory again. For prescription produce prescription project, just eligible for benefits or enrolled in benefits?
Yeah, that's a great question for determining what members may be eligible to be the participants in a produce prescription project. So should the first item, the risk of developing a diet-related chronic disease be met, then if the state plan or waiver were to be used to determine eligibility, the member does need to not only be eligible for that state plan or waiver, but also be enrolled in that program. Thank you.
Thank you. Next question would be for Stephanie or Beth. The question says, will in-kind contributions be accepted in lieu of matching requirements?
Yep, this is Beth. I can answer that. In-kind contributions are accepted, so uses of facilities, donation of equipment, supplies, other non-expendable property is allowable as a match.
Thank you. Okay, next question for NTAE. Are there existing reports on best practices, etc., that NTAE has published and made available?
I can answer that. This is Dina Nugent. Well, interesting you ask, because that's exactly why we are the NTAE. Our job is to do that, but we are just a year in, so not quite yet. We last year, because of COVID as well, we weren't able to analyze as much as we wanted to because data collection was very difficult. So we're hoping that at the end of this year, we'll have more information. There will be, I'm not sure if this is best practices necessarily. We do have a white paper, or it's a modification of the congressional report that we are building out that will be available, but it's not there yet. Anyone else in the NTA, do we have best practices as far as for programs in PPR and NI in general? I don't think generally we do.
Not at this
What I can add on the Nutrition Incentive Hub website, I'll put in a link in the chat. This is Noah from Fair Food. There are a bunch of different technical assistance resources in a toolkit of sorts, really broken down by whether it's reporting or evaluation or marketing communication. There's stuff focused on brick and mortar retail and other program administration. So depending on the specific kind of best practices that you're looking for, you might find resources already online. And if there are things that you don't see, we would definitely welcome those questions, again, coming to ta@nutritionincentivehub.org, and we'll either point you to the resources that exist or develop new ones to meet that need.
Yeah, thank you, Noah, because I always just think about evaluation. So I wasn't even thinking that maybe there were best practices on the implementation side. Apologies, thanks.
All right, next question is for Mallory. Will the application be more competitive if applicants have a budget for a contracted evaluator?
This is Mallory. All of the proposals have the same evaluation criteria. So in ensuring that your proposal responds to the expectation to have an evaluation that is going to be able to answer the question of, did your project achieve its goals and outcomes, and were you able to assess its impact? That's going to be important. There's no distinction for how that is achieved. That flexibility is up to each applicant. As of course we've been echoing here today, ensuring that whatever the evaluation plan is, that the minimum core data at the participant level and at the firm level are gathered and transmitted to the NTAE is required. So should an applicant decide that they want to use a third-party contracted evaluator, taking the care to include in that plan that the information, those core metrics needs to be shared with the NTAE so that they can aggregate and evaluate the program as a whole will be essential.
Thank you. Next question, again for Mallory. For produce prescription grant, does fresh, whole, or cut fruits and vegetables refer only to fresh, or does it also include canned or frozen without added ingredients?
Excellent question, and I appreciate the opportunity to clarify that. For the produce prescription, the prescription and incentives need to be for fresh, whole or cut fruits and vegetables.
Thank you. Next question for Mallory again. If we are a current pilot grantee, are we eligible to apply for a pilot grant again?
So it's important to take into account all of the evaluation criteria, one of which that was mentioned is that the GusNIP funding opportunity and mechanism is in existence to expand, to grow, to innovate in this area, not to replace existing funding or existing activities and efforts through a different, federal source, let's say. So I would recommend that be a part of what anyone's considering as a current grantee applying again. Certainly what is also equally important is that there is a prohibition on duplication of effort and being compensated for that on federal grants. So if an organization was to submit a proposal in 21 and they have an active award, it is essential that none of that time, effort, aims, none of those activities be exactly duplicated. A way that I like to use the analogy that I think really helps is that there can be work to ongoing, should the organization have the capacity to study how amazing fruits are, and then there can also be work going on to study how amazing vegetables are. But you cannot have two grants that are funded by NIFA or funded by another federal organization or that have the same aims.
Thank you. Next question is for NTAE probably. Question says, could you go into more details what is required as part of the evaluation plan write-up in the grant application itself and not evaluation requirements post receiving the grant?
I'm not sure. So the first question is, if in your application, how laid out do you need to make the evaluation plan? Is that the question?
Yeah, let me read this question again. Could you go into more detail what is required as part of the evaluation plan write-up in the grant application itself?
Yeah, so that sounds like it's specific to what would be in a proposal, and maybe that is a question suited for me.
Mm-hmm.
So
yeah.
I would say that what is required is a clearly communicated plan for how the project would be assessed and how that assessment is going to include the collection of the core minimum data set. And I do want to take this opportunity to elaborate on what the evaluation expectations are related to a self-assessment of the project meeting its goals and the outcome assessment. So all nutrition incentive grant proposals, all produce prescription grant proposals, whether they be pilot projects, standard projects, or large-scale projects, need to undergo a self-assessment process evaluation. The outcome evaluation is expected for the standard proposals, the large-scale proposals, and all of the produce prescription proposals. And so that's why there's that distinction with the pilot projects of the nutrition incentive grants. They still need to have that self-assessment, but they do not need to and are not required to collect the core minimum participant level and firm level data. If I haven't fully answered your question, you're welcome to email me with follow-up.
Thank you, Mallory. Next question for Mallory again. What is the earliest start date?
So NIFA would recommend that the anticipated start dates be around September of 2021. As we've shared, the peer review process does take between 6 and 9 months. We will do everything that we can to reach out to applicants within about 6 months of the application deadline with a funding determination. And it is important to understand that while NIFA will do everything that we can to process things as quickly and as efficiently, should a proposal be successful in competing for funding, the start date for that proposal will be determined by our awards management division. It's in negotiation, but there's no guarantee that, say, a desired start date could be promised.
Thank you. Next question for Mallory again. I think you already answered to similar question earlier, but the question says, can an established program previously awarded NIFA grant still be considered a pilot program if applying to this RFA would the program need to submit as a standard program?
Sure. So building off of what you've included in your question, if the established program was a pilot and it's the pilot that has been established, with the context I've got now, the only way I could see it not being duplicative or not supplanting existing work would be if there was the element of growth that and expansion, which would be, you know, moving from a pilot, you know, to a standard, to a large scale project. Otherwise, I'd be very concerned that it would be duplicative of the work that was already achieved under the initial grant.
Thank you. Next question is for our management division, Beth or Stephanie. So question is says, our organization is an existing large multi-county program. We are thinking of an application for a one-year grant. What would be the allowable budget? Would we be limited to the 100,000 one-year project limitation? Are hospitals and other healthcare organizations acceptable as program partners for a regular produce project?
So this is Mallory. I'll take the first opportunity to respond to that, and then you know, Beth and Stephanie, feel free to add on. So for an existing large multi-county program, I would be concerned that that such a program is not in the early stages, right, of development. And it's what you've referenced here, the 1 year project duration, $100,000 federal budget ask for nutrition incentive grants pilot projects would be a pilot, right? That developmental phase, those initiating these kinds of programs. An existing larger multi-county program that's, you know, adding elements, doing more, would likely be better suited for a nutrition incentive grant standard project or large scale project. To answer the second question of hospitals and healthcare organizations being program partners for nutrition incentive grants, as well as produce prescription grants, yes, absolutely. That would be acceptable. It, of course, would need to be, you know, appropriate for the goals of the project and the project design. And, you know, as we've mentioned before, you know, building out those key collaborations and those networks in the food system as well as the healthcare system is important to GusNIP.
Thank you. Next question is for Beth and Stephanie. Could you describe what indirect costs are if we are providing SNAP farms with incentive money? Is that considered indirect?
That's a great question. Thanks for asking. Historically, indirects have been called facilities and administration funds. So the types of funds that you need to keep your lights on and keep your buildings going. With regards to providing SNAP firms with incentive money that is considered indirect, we might need to discuss that a little further offline, and maybe you can reach out with some specifics on what you mean by that. I'm not quite sure. But there are definitions in the uniform guidance on indirect costs and what is applicable in those categories.
Thank you. Next question is for Mallory.
Sure. It looks like this this may be a slightly different flavor of a previous question. So the question I'm seeing is our current USDA grant will offer a funding extension of perhaps 1 year. Will applying for that extension impact our GusNIP application? We hope to dovetail the 2 awards to support different program elements. So having 2 awards that are focused on complementary but distinct goals would be allowable, would be possible, should they both be successful. And what's also of note would be that this program only invites new applications and resubmitted applications. So all proposals are, through that lens, their goals are to, to build and to broaden and enhance the work that is going on in this field. We don't accept renewals of existing work, which I think this has, to me, a little bit of a flavor of. So just to clarify that. And I would also like to mention that as Michael stated, where FNS is providing the flexibility for nutrition incentive firms, right, SNAP authorized firms, to continue should there be, let's say an initial group that would continue to be the firms utilized for fruit and vegetable incentives from a pilot progressing to a standard or large scale project. It's also important that you contact NIFA and work very closely with both, the program staff and our awards management division staff, Beth and Stephanie, because if the funds for those firm operations and those incentives are coming from grant funds, they need to be spent during the grant funding period, and they need to be in line with the purposes of that grant, and that's important to navigate expertly as well.
Thank you. Next question is for Mallory again. For the nutrition incentive grants, are we allowed to work with a SNAP retailer that is fully delivery based?
So for the nutrition incentive grants, so long as you're working through an authorized SNAP retailer, their actual location, brick and mortar online delivery, that flexibility is at your discretion. Michael, would you have anything you would want to add to that?
No, I don't. Thank you. That sounds accurate.
Thank you. Next question is for Mallory and Beth and Stephanie. How are organizations structured as cooperatives counted regarding matching, because cooperatives are legally not for profit, so different than both non-profit and for profit. Would staff time at cooperatives count as a match?
I'm going to go ahead and let Beth and Stephanie respond to the matching question.
So this is Beth, and I'll try to do my best here. And if we need to explore this further, we can. But yes, that would be considered an appropriate match. As I'm reading it right now, the cooperative count as a match. Yes, it would. Their time.
Thank you. next question is for maybe Mallory. Are individuals who participate in Puerto Rico's NAP program, NAP, able to take advantages of this program?
So consumers who are receiving Puerto Rico's NAP can be participants in a nutrition incentive grant. And should they be at risk of developing a diet-related health condition, then they could also participate in a produce prescription program. So yes.
Thank you. Next question is for Mallory and Beth. Would volunteer time to operate an incentive program, for example, at farmers markets, used as match, be defined as admin and be counted toward 20% admin limitation?
That's something that we would look for very carefully in the budget justification to see how that volunteer's time was being used. If it was project specific and it was for the deliverables of the objectives, then it probably would not be part of the admin limitation. But if it was for the general administration of the project, then we might have some extra questions on where that would belong.
Thank you. The next question is for Beth again. Does the ratio of cash versus in-kind match matter in our application's competitiveness?
I might throw that back to Mallory because I'm dealing with these after that they've been competed, I guess.
Yep. No worries. So as long as the required match for nutrition incentive grants is present, how a grantee comes up with that match is really up to you, and that does not enter into the evaluation process. So all of these proposals are, so long as the requirements are met, right? With the pilot projects, the nutrition incentive grants having the match requirement and the produce prescription grants not. So long as all of those requirements are met, it's up to the grantee how they structure their program and their program plan. And it's that program and program plan taken collectively that gets evaluated. Exactly what is cash or in kind is not one of the evaluation criteria.
All right, next question is for Mallory again. Can you describe where incentives to SNAP farms go in the R&R budget?
These are typically supply costs. Beth, do you have any other advice you would offer?
No, I think in supply costs would be appropriate, or you could use the DC other category and specifically delineate out those costs for us.
Thank you. Next question is for Mallory and Michael. So the question is about the frequently asked question posted in the GusNIP website. The question 3 in this FAQs document says, do GusNIP programs have to have a produce for producer design? So,
Yep, I'm happy to take that question. So yes, they do. The authorizing legislation for this program is very clear on this point. Fruits and vegetable incentives for fruits and vegetable purchase and And if you would like to reach out to me for further discussion, I'm happy to follow up with you.
All right, I'm scroll down questions. All right. Next question is for produce prescription grant. What is the relationship to SNAP authorized retailers and produce prescription grants? Is there an MOU with SNAP form requirement for produce prescription grant? Mallory?
Sure. So I'm first gonna take the opportunity to say that for all produce prescription grants, that documented partnership with the healthcare provider is an essential required document for the application. And then the SNAP authorized retailers will depend on how you choose to design your produce prescription project. Should you use a financial incentive model that involves, SNAP, involves a SNAP as one of the incentive mechanisms, then all of the SNAP regulations must be followed. And with that, having those memoranda of understanding in place with each of those firms would be the expectation.
And there's a subsequent question to go with the previous question, especially if patients are receiving produce prescription incentives based on eligible insurance and not based on SNAP enrollment. Do redeeming forms still need to be SNAP authorized?
That's a great example of how the design of a produce prescription project is really at the core of being able to answer this question. So should the design for the produce prescription project be the risk for chronic diet-related health condition and enrolled in a state waiver or plan, and then if there is a non-financial incentive model, if it's the prescription and the procurement is going to be handled at a different site, that's a possible model that could absolutely be proposed. If instead your model wants to use SNAP sites and SNAP incentives, then all of those regulations and expectations need to be met.
Thank you. I'm checking time right now. It's 1:35 Central Time. And Mallory, do you want to proceed additional questions to be answered?
I think what we can do is, because we've already exceeded the time we've asked for all of you, for all of our speakers, and on all of your calendars. We will be sure, NIFA staff, to capture all of the questions that are in the chat and have those questions addressed by the speakers here today and included in an update to the frequently asked questions document on the NIFA GusNIP website, so that those are available to you all. And as a reminder, the recording of the presentation today will also be posted on that same NIFA GusNIP website.
All right. Thank you for participants for your time to join this webinar, and we hope this webinar was helpful. And again, please check back our GusNIP website, and you can reach out to NIFA GusNIP team. And thank you so much for your participation. And for speakers, we really appreciate your time and great presentation today. Thank you so much. Mallory, do you have any other closing comments?
Thank you all so much for the work that you do. Of course, as you know, this is an area of great need, addressing nutrition security in these times. So we very much appreciate all of the work you do and look forward to receiving some really wonderful applications. Thank you all.
You will close the poll now.
Thank you all.
Thank you.